How to provide rescue breathing and chest compressions in an overdose situation. Helping a person breathe by doing rescue breaths and chest compressions is important to keep the brain alive during an overdose. These steps may also be taken if you have given naloxone to a person who is overdosed and are waiting for the medication to take effect. These are the signs you should look for before beginning rescue breathing and chest compressions. The person is unconscious and not waking up. They don't respond to shouting or rubbing knuckles on the breastbone or between their upper lip and nose. They are not breathing normally. To begin rescue breathing, if the person is not breathing, follow these instructions. Open the person's airway by placing one hand on the forehead and the other hand on the bony part of their chin. Gently tilt the head backward, slightly lift the chin. Make sure their airway is clear. Pinch the person's nose shut and cover their mouth with yours. Take a regular, not a deep breath. Give one rescue breath for 1 second. Give a second rescue breath for 1 second. You will know you have given enough air when you see the person's chest begin to rise with the breath you give. As soon as you see chest movement, stop that breath. Be careful not to give too much air. If the person's chest doesn't rise on the first breath, try repositioning the head or the airway and trying another breath. To give chest compressions, follow these instructions. Once you have given 2 rescue breaths, do 30 chest compressions. Here's how. Place the heel of one hand on the center of the person's chest. This is the lower half of the sternum. Place the heel of the other hand on top of the first hand so that the hands are overlapped and parallel. Push hard and fast, 2 inches deep for anyone over the age of 1. Allow the chest to fully return to normal position after each compression. For every 2 rescue breaths, give 30 chest compressions. Within the space of a minute, you should give between 100 and 120 compressions. For guidance, try to imagine giving compressions to a normal beat of row, row, row your boat. Keep doing rescue breathing and chest compressions. Stop if the person begins to breathe normally on their own, they regain consciousness or wake up, you are exhausted and can't continue. EMS, police, or other trained first responders arrive and take over care. Although the risk is low, mouth-to-mouth rescue can transmit infectious diseases. Consider your own safety before providing assistance. Devices such as a pocket mask or face shield are designed to protect you while you deliver rescue breathing, and should be used according to the manufacturer's recommendations. The Good Samaritan Law provides some legal protections to anyone who gives naloxone and calls 911 in an overdose situation. For more information or to obtain CPR training, visit the American Heart Association's website at heart.org.